Baking soda, a common culinary ingredient, has recently garnered attention as a potential health enhancer, with purported benefits spanning from boosting athletic performance to alleviating acid reflux. Known chemically as sodium bicarbonate, this alkaline substance is made up of sodium, hydrogen, carbon, and oxygen. Its well-known acid-neutralizing abilities make it a popular component in antacids used to combat heartburn and indigestion. When mixed with water, baking soda increases the liquid's pH, rendering it more alkaline. This property has led many to believe that consuming baking soda water could help in balancing the body's pH levels, potentially easing symptoms associated with acid-related issues. However, the human body is adept at maintaining a delicate pH balance, particularly within the bloodstream, which typically hovers between a pH of 7.35 and 7.45. Our bodies are highly efficient at regulating pH levels, notes Grace Derricker, a registered dietitian and spokesperson for the Academy of Nutrition and Dietetics. She cautions that while baking soda can neutralize stomach acid, regular use may interfere with the body's natural pH control, potentially leading to metabolic alkalosis, a condition where the blood becomes excessively alkaline. One of the most frequently cited benefits of baking soda water is its potential to enhance athletic performance. During intense exercise, the body generates hydrogen ions, which increase the acidity in muscles and blood, contributing to fatigue and reduced performance. Dr. Tamara Hugh Butler, an exercise physiologist and associate professor at Wayne State University, explains that consuming baking soda before exercise may help buffer this acidity, allowing athletes to sustain higher levels of intensity for extended periods. Research has shown that athletes who ingest baking soda prior to activities like cycling, running, or rowing experience delayed muscle fatigue. Taking baking soda can enable your muscles to work longer and harder, says Dr. Hugh Butler. However, she emphasizes that timing and dosage are critical, as excessive intake can cause gastrointestinal discomfort, such as bloating, nausea, and diarrhea, side effects that could significantly impair, rather than improve, performance. In addition to its potential athletic and cardiovascular advantages, baking soda is also lauded for its ability to aid digestion and alleviate symptoms of indigestion and acid reflux. Jennifer Chrisman, a registered dietitian and clinical nutrition director at OPTAVIA, explains that the alkaline nature of baking soda can neutralize stomach acid, offering relief from heartburn and sour stomach. Some individuals find that drinking water with a spoonful of baking soda eases indigestion, Chrisman says, adding that the basic properties of baking soda can lower the pH of an acidic solution. Britt Brandon underscores that baking soda can alleviate accumulated gas by helping the body return its pH to neutral, thus soothing the digestive system. This adjustment enables food to be broken down more efficiently, reducing discomfort. Additionally, Brandon suggests that regular consumption of baking soda water may bolster kidney health by maintaining balanced pH levels, enhancing hormone regulation, and aiding in nutrient absorption. However, the benefits of baking soda do not come without potential risks. Excessive or prolonged use can lead to severe health complications. Metabolic alkalosis, a condition in which the body's pH becomes overly alkaline, can disrupt normal physiological functions, including heart rhythm and blood pressure control. Symptoms of this condition include confusion, muscle twitching, hand tremors, and in extreme cases, seizures or comas. Moreover, baking soda is high in sodium, with a single teaspoon containing over 1,200 milligrams, nearly 80% of the recommended daily sodium intake for most adults, according to the American Heart Association. High sodium intake is associated with increased risks of high blood pressure, heart disease, and stroke, making the regular consumption of baking soda water potentially dangerous, especially for those with pre-existing cardiovascular conditions. Baking soda can also interact with certain medications, diminishing their effectiveness or heightening the risk of side effects. Individuals taking medications for conditions such as hypertension, kidney disease, or chronic heart failure should consult with their healthcare provider before using baking soda as a supplement. Given these potential dangers, experts recommend using baking soda sparingly and only under medical supervision. There's no one-size-fits-all dosage, says Grace Derricker, emphasizing that what may be beneficial for one person could be harmful to another. For occasional relief from acid reflux, a small amount of baking soda, such as 1/4 teaspoon mixed with water, may suffice, but it should not become a habitual remedy. In conclusion, while baking soda water may offer certain health advantages, it is not a panacea and should be used with caution. Gaining a clear understanding of its effects on the body and seeking advice from a healthcare provider can help mitigate the potentially serious risks associated with its misuse.